So Charlie, what do you think are the most important considerations when you're completing a holistic wound assessment for your patients?
I think first and foremost is to do that holistic assessment of your whole patient, Michelle. It's really important for us to understand what is going on with that patient, what their comorbidities are, if they've had any wounds before, and if they have, what their healing time has been. Has there been any complications with that healing? I think it's really important that we have that oversight of the whole patient, because by doing so, we can help to improve that patient's healing outcomes, hopefully, if we're able to manage some of that, some of the comorbidities that they may be having. And once you've done that really robust assessment of your whole patient, it's really important to look at the patient's wound. We need to look at all three aspects of the wound, so the wound bed, the wound edge and the peri-wound skin, because without looking at all three aspects of that, it's going to make it very difficult to heal that wound.
Of course, so the triangle of wound assessment is really important when it comes to looking at the patient's whole holistic needs.
Yeah.
So whether that's the comorbidities that you mentioned or their social circumstances, and then importantly, the wound bed, the wound edge and the peri-wound skin. And the importance of that really is achieving those good patient outcomes. We want patients to have the best care, and we can only do that by providing a holistic wound assessment.
Absolutely, and the triangle of wound assessment really simplifies that approach, because it breaks it down for the wound assessment into 3 simple steps, looking at your wound bed, wound edge and your peri-wound skin.